This is a place where you need to come and watch and we talk about Ozempic and Wegovy, because I feel like we do this a lot because it's such a hot topic.
Well, because I want to go on it, and so far nobody's given it to me yet.
No one needs to give it to you. The doctors are smart. Okay, but between the two of them, Ozempic, Wegovy, Mounjaro, they've become the norm when we're talking about these weight loss drugs.
All right, the shots are so popular that they've led to shortages, and some people, including celebrities, they're being scrutinized for using them. Recently, Oprah Winfrey admitted that she now uses a weight loss medication after years of struggling with her weight. Joining us right now with more is New York City's medical weight loss specialist, Dr. Sue Decotiis. Nice to have you here on Good Day New York.
Happy holidays.
Happy holidays. So let's talk a little bit about the holidays, because I'm hearing, you know, some people want to have that holiday drink. They want to eat a holiday cookie. So they're taking themselves off Ozempic, which is not a good thing to do, right? I mean, can you go on and off these weight loss drugs?
You can, but there's no reason to. So all of my patients are enjoying the holidays, and they plan on losing weight during the holidays. So when you're on these medications, you feel very full, you feel very sated. You can eat small amounts. So you can just pick and enjoy everything. So it gives you the freedom of being able to enjoy the holidays.
So I see that you brought it with you. Okay.
So this is Ozempic, right?
Okay.
So this is an older medication. It's still very popular.
Right. And this is what it looks like inside?
And this is what it looks like. So you put a needle into this.
Yeah. Let me
there
see
are
that
little
side.
needles that...
Needles?
It almost looks
Don't
like
give her the full thing, because she's going to try
It's loaded, so I don't want to...
Get out of here.
Oopsie. I didn't see a needle there. Is there a
it's
needle?
underneath. You have to take the cap off.
Oh.
Don't you dare.
And then you
take that.
push. And then you push.
Then you push.
Right.
So it's so simple.
It's
just
very
like,
simple.
It's
right.
like a pen.
Now this is Mounjaro. This is tirzepatide. This is a compounded variety, and the reason why this is great is that we can customize the dose. Ozempic only comes, or commercially available drugs only come in set doses. And as we were saying before, it's really important to bring people up slowly until they're in the fat burning zone, and then titrate them down. This is how they keep the weight off.
Okay, so that's what I was going to ask, is because, you know, there's certain friends that I have that are like, I just want to, you know, lose 15 pounds, 10 pounds. But I was like, well, why are you going to take this stuff? Because then you're going to have to be on it forever. Once you stop taking it, you're going to gain the weight back.
So unless you're highly insulin resistant, or let's say you're older, you have other medical problems, this reboots your insulin. So the way that this drug works, it's not just an appetite suppressant. It really rewires your body. It makes insulin work better. As we get a little older, we get that little punch. We can't really lose it at the gym anymore. It's because our insulin isn't working. So when we reboot that insulin, we become a fat burning machine again. And the mistake a lot of people make, and a lot of doctors are not, because they don't have it, they're not able to follow patients on a body composition scale. That is essential.
Is that why we're hearing so many problems? There's so many issues with this, stomach problems, GI problems, and this is all coming from what?
Well, the GI problems can happen in the beginning, a little nausea, maybe a little vomiting, but the muscle loss that you're hearing about should not occur, because when you stabilize insulin, your body is stronger. It's like it was when it was younger. You make muscle, you make bone, and you burn fat. So we follow the patient on a body composition scale. I want to see what's your muscle mass, what's your fat, and that's how, when you get to your goal, that's how I taper you off the medication. I've had women in their 70s be able to be effectively tapered off the medication, and they've been able to maintain their weight loss.
Because they're maintaining the amount of food they eat, which is a little bit?
The other thing that nobody talks about is hydration. Even in the package insert, a lot of times they don't mention you must drink a lot of water when you're on these medications. If you don't, the drug doesn't work as well, and you could lose muscle. Many doctors are not telling their patients that, but in medical weight loss we understand that your body, the fat is all water. So when you're burning fat rapidly, you're losing water, you're becoming dehydrated. And a lot of the symptoms that you mentioned, like the nausea, feeling tired, a lot of that's from being dehydrated.
Okay, what about the constipation and the diarrhea? Because I'm hearing people having accidents in their bed.
Yeah, that's pretty unusual.
Oh my God.
It's true.
Yeah, that's pretty unusual.
It's unusual.
I'd say constipation's a little bit more common than diarrhea. I think the key side effect in the beginning is nausea. Most of that is mitigated by drinking a lot of water.
Okay, the other thing I heard is, if by chance you have to have some kind of surgery, you have to be careful if you're on Ozempic, because the food still stays in your stomach longer. So when you think that you're fasting and the next day you're doing surgery, you may not be fasting enough.
Well, a lot of surgeons are going to tell their patients to maybe stop it a week before.
Okay.
Some surgeons don't. A patient of mine just got a facelift and she was able to continue losing.
Wow, in that case, wait, what happened? She had the facelift and no problem?
Yes, she looks younger than ever and she's got a great body.
Ozempic face, can we talk about that?
Yes, so that's a bit of a myth, okay? So what happens is when we're heavy for a while and we're older, all of that weight really lays on our collagen. We don't reproduce collagen as much as we did when we were young. So when you lose that weight, you see the aging on your face. It's not the drug. It's just that your aging is revealed.
Really? Okay, because from my understanding and what we kind of look at, we see certain celebrities that lose this drastic amount of weight and their face looks bigger.
But again, what's their muscle mass? Now, if you've got that big head, you know, like the lollipop head, that's people that have lost way too much weight. That doesn't happen in my practice because we're following everybody very carefully.
Sharon Osbourne, Ozzy Osbourne's wife, she's complained that she's lost too much weight. She can't get off it. Now, she's got to be going to a good doctor. She's got a lot of money.
I really don't know. Not every physician is trained in medical weight loss. Is she getting on a body comp scale? If she were my patient, I would stop her at a certain point, start titrating her down, and look at her diet. Maybe she's not getting enough protein. Maybe she's not hydrated.
All right, Doc, I'm going to give this back to you. Where can people find
I will make sure that she gives this back to you. She don't need it.
Let me just try one little thing. Where can people find you?
Well, Sue Decotiis, MD. I'm right here in New York City.
Yeah.
And I specialize in medical weight loss, Midtown Manhattan.
Thank you so much.
Happy holidays.
You better get that back. If you walk off the set, you might not get it back.
Remember, no food noise with this medication, right?
What do you mean?
Well, you know, when you're hungry all the time, you're always thinking about food. That goes away with these medications. That's why you can enjoy the holidays. You're not obsessing about having pizza or having this or having that. You can have a little bit with your family. No one will even know you're on the medication.
Doc, the minute I wake up, I'm planning my meals for the day. It's
That's
crazy.
not going to happen with this.
Oh, my gosh.
I have breakfast, I'm thinking about lunch. I have lunch, I'm thinking about dinner.
Wait, dude, this is a transaction now? You're going to go get
I'm going away for the holidays. I planned every meal. Every meal is done.
Thank you, doctor. We appreciate it.
Thank you, Doc. Nice to meet you.